A 52-year-old man presents to the clinic complaining of blood in his urine. He had a mild respiratory illness 3 weeks ago. Urine analysis reveals a high red blood cell count and casts in the urine. A diagnosis of post-streptococcal glomerulonephritis is made. The physician explains that the treatment is supportive and that the patient needs to follow up with him every 2 weeks. 6 weeks later, the patient returns to the clinic because he does not feel well. He has been experiencing malaise and fatigue. On examination, his pulse is 98, blood pressure is 135/85 mm mercury, temperature is 98 degree Fahrenheit, and respiratory rate is 60. He has a mildly distended abdomen. Blood tests reveal that patient's creatinine level has increased from 1.2 mg per deciliter to 3 over the last month. He is referred to a nephrologist who diagnoses him with rapidly progressive glomerulonephritis and starts him on hemodialysis, as his potassium level has risen to 7 milliequivalents per deciliter. The patient is advised to undergo renal transplantation. His human leukocyte antigen (HLA) genotype is A7 by A5, B2 by B9, C8 by C3. First allele in each locus is the maternal form, second is the paternal. Several potential donors are available for the renal graft. Which of the following would be the closest match? Okay, I'll leave the question up over here and the options. Go through the question, it is a long one, but it's not that tough. Actually, it is very simple. Option A, donor B, T A5 A12, B 22 9, C 4 C3. Option B, donor A, A7 A5, B8 B2, C3 C8. Donor E, A7 A8, B9 B27, C3 C4. Option D, donor C, A7 A4, B2 B4, C8 C3. Option E, donor D, A4 A7, B1 B8, C8 C3. So all of this upper big part is useless for us. All we need to know is that the patient is RPGN. He's going a renal transplant. And his HLA genotype is this. HLA genotype is this. Okay. And potential. So what you need to know is that most of the matching types of HLA genotype antigens should be there in the donor. So here we have A7, A5 is there. B8, B2. We have B2 which is matching. B8 is not matching. That is all right. C3, C8. C3 and C8 are also matching. So this is the only one is not matching. Over here B A5, A12 and then B22 and B9. So that is gone over there itself. A7, A8, B9, B27. Here also it is more than 2. A7, A4, B2, B4, A4, A7, B1, B8. Here also it is more than 2. So our only possible option is option B.
Thanks for watching. Please give a thumbs up and subscribe for more.